Thank you for joining us. Our names are Dr. Janine Collins and Dr. Grace Percalipicorn. We are both pediatric ophthalmologists, and we would like to talk to you about retinopathy of prematurity, also known as ROP. This picture is a diagram of the different parts of the eye. The retina is the inner layer of the back of the eye. Light enters through the front of the eye and focuses on the retina. The retina then turns that light into a visual message and sends the message to the brain to allow you to see. Retinopathy of prematurity, also known as ROP, is a potentially blinding disease caused by abnormal development of retinal blood vessels in premature infants. In premature infants, the retinal blood vessels, shown in the picture, are underdeveloped. Usually the infant would still be in the mother's womb when the eyes finish developing. Because the child is not in the womb, the growing environment is different, and the retinal blood vessels can grow abnormally. Here are a few photographs of the retina. On the left is an image of a normal, fully developed retina. Notice how the blood vessels reach the edges of the image. On the right is an image of an immature retina. Notice that the blood vessels do not reach the edges of the image. The yellow arrows show where the blood vessels end.
It is important that your child is screened for ROP if considered by his or her doctor to be at risk for ROP. Most infants who develop ROP will only develop a mild form of the disease that will improve on its own without causing damage to the retina. Most babies with ROP will develop normal vision for their age, but some infants will develop a severe form of ROP that can lead to a retinal detachment. A retinal detachment is when the retina becomes pulled away or separated from the eye wall, as shown here by the red arrows. This can lead to permanent blindness. There are approximately 3.9 million infants born in the United States each year. About 14,000 are affected by ROP, and 90% of those affected will have only mild disease that resolves on its own. About 1,100 to 1,500 develop disease severe enough to require medical treatment. Despite available treatment, 400 to 600 infants each year in the U.S. become legally blind from ROP. Not all infants born prematurely are at risk for ROP. Those at highest risk for ROP are born before 31 weeks gestation or weigh 1,250 grams, just under 3 pounds, or less at birth. Typically, all infants less than 31 weeks gestation or born weighing 1,500 grams, 3.3 pounds, or less, undergo eye examinations to monitor for ROP. Birth weight and gestational age are the most important risk factors for developing severe ROP. Other factors that are associated with the presence of ROP include anemia, poor weight gain, need for blood transfusions, breathing difficulties, and poor overall health. While less common, ROP can affect infants born at older ages and higher birth weights, particularly if they have one or more of these risk factors. Infants who are at risk for ROP are usually identified by a nurse or doctor in the neonatal intensive care unit, also called the NICU. If your baby is at risk for ROP, an ophthalmologist will perform several eye exams at repeated intervals to screen for ROP. An ophthalmologist is an eye physician who is skilled in the evaluation of infant eyes. Multiple eye exams are necessary because it cannot be predicted which babies will do well and which will develop problems. It is critical for your infant to be examined as scheduled because ROP can progress quickly. Eye exams need to be repeated until the retinal blood vessels have finished growing or the child is no longer at risk for ROP.
In order for the inside of the eyes to be examined by an ophthalmologist, eye drops will be placed in your infant's eyes to dilate or enlarge the black spot in the center of the eye known as the pupil. When the pupil is dilated, the ophthalmologist will be able to look at the back of your infant's eye to examine the retina. During the exam, your infant will be positioned and made comfortable by methods such as swaddling with a blanket and sometimes given a sugar solution by mouth and/or a pacifier. Instruments may be used to hold the eyes open and move the eyes during the examination. A numbing drop may be placed prior to this. The ophthalmologist will use special equipment to examine the inside of the eye. This equipment has a bright light which allows the ophthalmologist to examine the retina. A camera may also be used to photograph the retina. There is active research evaluating the effectiveness of digital photography for diagnosing ROP. When the ophthalmologist looks inside your infant's eyes or at photographs of the retina, He or she is evaluating the level of development of the retina. The ophthalmologist looks for the zone of growth, stage of disease, and appearance of the retinal blood vessels. The zone is how far out the retinal blood vessels have grown. The stage is the severity of ROP. And if the retinal blood vessels in the back of the eye have become thick and wavy, it is called plus disease, which can be a sign of severe ROP.
Retinal development is described by three zones. Zone 1 is the least developed, and Zone 3 is the most developed. Retinal blood vessels that have not grown out very far are the least developed and remain in Zone 1. In this image, Zone 1 is the area shown in yellow, with the retinal blood vessels in red not extending beyond Zone 1. As the retina develops, the retinal blood vessels will grow out from Zone 1 and into Zone 2. In this image, Zone 2 is the area shown in yellow, with the retinal blood vessels shown in red, extending beyond Zone 1 and into Zone 2. As the retina continues to develop, the blood vessels will continue to grow into Zone 3. In this image, Zone 3 is the area shown in yellow, with the retinal blood vessels shown in red, extending beyond Zone 2 and into Zone 3. Once the retinal blood vessels have grown to the edge of Zone 3, they are finished growing, and the retina is considered to be fully developed.
If ROP is present, the ophthalmologist will describe the severity of ROP as the stage of ROP. There are 5 stages of ROP. Stage 0 is the most mild, and Stage 5 is the most severe. Here is a photo of Stage 0 ROP, which is the least severe form of ROP. In Stage 0 ROP, the retina is still underdeveloped. See how the retinal blood vessels stop early, as shown with the white arrows. Here are photos of Stage 1 ROP. You can see a line separating the developed retina from the underdeveloped retina, shown with the white arrows in both photographs. Here is a photo of Stage 2 ROP, shown by the white arrows, where the line between the developed and the undeveloped retina becomes an elevated ridge with height and width. Stage 2 is a moderate form of ROP. Here are photos of Stage 3 ROP, shown by the white arrows, which is considered severe ROP. In Stage 3 ROP, there is an abnormal growth of the new blood vessels. Instead of growing normally along the surface of the retina, they begin to grow above the retinal surface. These abnormal blood vessels are leaky and can cause bleeding within the eye. Here are photos of Stage 4 ROP, shown by the white arrows, where the abnormal retinal blood vessels have caused the retina to be pulled away or detached from the wall of the eye, known as a retinal detachment. Despite accurate diagnosis and timely treatment, the ROP sometimes continues to worsen and the retina can detach. In Stage 4 ROP, only part of the retina is detached from the eye wall. Here are photos of Stage 5 ROP, where the entire retina is detached from the eye wall. This is the most severe form of ROP. Eyes with retinal detachment caused by ROP generally have poor visual outcomes. Lastly, the ophthalmologist will describe if the retinal blood vessels are thick and wavy or irregular. In the figure on the left, notice how normal retinal blood vessels are thin and gently curved. As ROP worsens, the retinal blood vessels can become thick and wavy as shown in the figures in the center and on the right. This is called plus disease and is a sign of severe ROP.
Your infant is at risk for ROP until the retina is fully developed. This is why continued repeated eye exams, even after your baby is discharged from the hospital, are very important. The only way to identify severe ROP is to have an ophthalmologist examine your infant's eyes as scheduled. This way, treatment can be performed in a timely manner when necessary in order to prevent blindness. The ophthalmologist may need to examine your infant's eyes multiple times. Exams generally take place every few days to every few weeks depending on the level of development of the retina and the severity of the ROP. It is very important that your infant's eyes are examined on schedule as recommended by your doctor. The timing of these exams is critical to help minimize the risk of vision loss. The good news is that there are treatments for ROP. If the ROP becomes severe and the potential for retinal detachment and permanent vision loss becomes great, treatment is warranted. It needs to be treated in a timely fashion to reduce the chance of your baby developing a retinal detachment and permanent blindness. There are two main types of treatment for ROP: laser treatment, as shown here in the photo, and injection of medication into the eye. The laser treatment usually has a good outcome with the disappearance of the abnormal blood vessels. An alternative to the laser surgery involving an injection of medication into the eyes is sometimes used. The effectiveness and long-term results of the injection of the medication into the eyes are still being studied. Infants may require treatment in one or both eyes, and some infants require repeated treatments and/or more than one type of treatment.
As mentioned previously, despite accurate diagnosis and timely treatment, ROP sometimes continues to worsen and the retina can pull away from the back of the eye, known as a retinal detachment. If a retinal detachment does occur, there are possible surgical treatments. However, those treatments are challenging and vision may be permanently limited. The goal of regularly scheduled screening and treatment guidelines is to avoid retinal detachment and protect infants from permanent visual loss. Premature infants are at greater risk than full-term infants for other eye problems. These include amblyopia, known as a lazy eye, strabismus, a misalignment of the eyes shown in the image on the right, glaucoma, increased pressure within the eye, an early need for glasses, and severe visual impairment. Thus, long-term follow-up is needed with an ophthalmologist to help identify these potential eye problems that may develop.
In conclusion, prematurely born infants are at risk for developing retinopathy of prematurity until the retinas have fully developed. Severe ROP can lead to a retinal detachment and result in permanent visual loss. An ophthalmologist can screen for and treat severe ROP to reduce this risk of vision loss. Frequent repeated eye exams are very important, not only in the hospital but also after hospital discharge. You can help increase the chance of good vision for your infant by bringing your infant in as scheduled for follow-up eye examinations. More information on retinopathy of prematurity can be found on these websites. For more information on this or other eye-related topics in children, please visit us on the web at aapos.org.